good idea to have more tests available. I think currently it's not convenient enough for people. I do worry a bit about having patients that are symptomatic exposed to other people in the store. So I would think as long as the right precautions are taken, that it would be a good idea.
I'm glad they're doing the shots here, but I'd be a little leery.
One hopes that if this is going to be going on, that appropriate precautions are taken to make sure that those who might be more vulnerable are not put in the same place as those who may be coming to be tested who might be carrying the virus. And so, again, I rely on expert advice and making sure they've asked all the right questions of the right people, and common sense and responsibility on the part of corporate people and on behalf of citizens. And I think we can make all this work.
When you walk in, first of all, anyone walking into the stores, we still have a masking policy. They're gonna have dedicated lines going into the pharmacy, but we're gonna throw everything we can at it. And I think the pharmacies were one of the saviors when it came to making sure that we got people vaccinated. They played such a major part in it. The independent pharmacies and the other big brand pharmacies. So I have confidence they'll do a fine job.
People with COVID-19 symptoms will soon be able to get tested at some Ontario pharmacies. Ontario's Ministry of Health will allow pharmacies to conduct COVID-19 tests on symptomatic patients for the first time.
CB24 has learned tests could get underway as early as this week. The program is voluntary and open to any willing pharmacy in the province. And joining us live tonight to talk more about this plan is Kiro Massa, pharmacist at Lawler Pharmasave, and Dr. Alon Vaisman, infectious diseases physician at University Health Network. Thank you both for being with us. Dr. Vaisman, there's some concern here. You know, some people saying there's a lot of people who show up at pharmacies, perhaps to pick up prescriptions. We're talking young kids, the elderly, the immunocompromised. Is this move worth the risk?
Yeah, I think the principle of expanding testing is a good one, but the details are very important in this case. To give you an example, when we set up our assessment center where we do COVID testing at our hospital, we had to do a very careful assessment of the environment to make sure that it's safe for patients to come in, for healthcare workers to examine them and to do a swab on them, and then for the patients to leave. So I wonder whether the pharmacies that will be set up to be doing this, whether they had the proper assessments. So it really all boils down to the details and whether the specific pharmacies chosen to do this have the appropriate needs to actually do it safely.
And Kiro, one of the things I wanted to find out from you, is this something that pharmacists and pharmacies actually want, given the fact that you will see an influx of people with symptoms of COVID-19, you know, given the rationale behind, you know, keeping this infected people away from the people who are not sick. You know, is this something that you want in your pharmacy?
So I can only really speak for myself. In my circumstance, if this is true, this is getting approved, it is something that I personally would want because it will allow better accessibility for people to be tested. At the same time, also, as Dr. Vaisman kind of alluded to, is that we have to pay attention to the details, and different pharmacies have different circumstances. In my case, I have direct access to the street, so information gathering can be done over phone or internet, and then actual active swabbing can be done in the outdoors, so there's zero risk to any of the patients or any of my staff. Can the same be said for other pharmacies? I don't know. I can't speak for them, and I can't speak for the mitigation tactics that they will assume so they can ensure the safety of their employees as well as their customers. But at the end of the day, the purpose is to ensure public safety and enhance accessibility for testing so that we could ensure the safety of Ontarians this winter, and so we could have a Christmas that will hopefully be very different from that of last year.
Dr. Vaisman, the Premier here says that there will be dedicated lines, a separate area where these tests are conducted. You talked about the details. What do you think we have to do to ensure this is a safe process?
Yeah, I think a lot of pharmacies probably don't have the setup that will make it easy to do this. Some of them might, as was described. But the things we look for is to make sure that the two populations of people who are coming in to get tested and those who aren't are entirely separated. So even a space where they're not sharing the same area at all would be ideal. So a separate entrance, for example, someone to actually guard the entrance to make sure the appropriate people are entering into that area. So like a security guard or somebody to stand there, appropriate check-in, appropriate screening of people also. The other aspect to this isn't just the infection control, which is actually pretty challenging to manage in most settings, but also the healthcare aspect to it. So if somebody's coming in with symptomatic, you need to have somebody on site who can do at least some moderate assessment on the patient to make sure that they're not unwell enough to need to go to a healthcare facility immediately. And then being able to test those people in a room that's well ventilated with the appropriate PPE being worn by the healthcare workers. So separating out the patients from the other people attending to that pharmacy and having the appropriate facility and PPE is very critical here.
I want to pick up on that. Kira, we'll come to you next because you say you have the resources and you have access to some outdoor space, and that's a game changer. But for other pharmacies, are you worried about air filtration, air ventilation?
So to get one thing out of the way, COVID is airborne, okay, just so that we can put that to rest. How people or how different pharmacies mitigate the risk for their customers and their staff, that is their responsibility. Is this good for Ontarians? In my opinion, it would be. But how they mitigate the risk in their circumstance, every pharmacy, as the doctor here has mentioned, has to truly assess if this is something they can do safely. In my circumstance, I have the appropriate PPE. I have a very well ventilated outdoor area where I can do this. And many pharmacies can also do this as well. Some other pharmacies have other mitigation tactics, and they're certainly responsible for doing so.
And Kira, I'm curious, you might be in support of this, but for other pharmacies out there that might have to invest in additional ventilation, they might have to invest in additional staff members and other kind of circumstances to make this all a go. Can you see how maybe other pharmacists might not be on board with this decision?
If, again, this decision does come to fruition, it is, from my knowledge, or what's being discussed, it's an optional sort of service that you could opt in or opt out of. And not all pharmacies are obliged to do this, and not all pharmacies have the capacity to do this.
Okay, yes, it is voluntary. That's important to note. Dr. Vaisman, last question for you. If I maybe have a young child or a grandparent, somebody who has an underlying health condition, what do you suggest? Should I maybe avoid that kind of pharmacy where they are conducting this kind of testing?
Well, I think it depends on why you're coming to the pharmacy and what the specifics are in your area. There's some parts of Ontario that may be more sparsely populated without as easy access to pharmacies, for example, where you may need to go get care there and get your medication or whatever it is you need to get at a pharmacy. And so if there's other people being tested there, you have to look at the situation. So all the details we've discussed so far, you need to make the assessment and to speak to the pharmacy to understand what their mitigation strategies are, as was mentioned. So I think each individual needs to make an assessment for them. There's a specific city or town where they're living in Ontario and where else they might provide care or might get tested. So unfortunately, it's not a one-size-fits-all answer.
Okay, we'll have to leave it there. Kira Massa and Dr. Alon Vaisman, thanks so much for your perspective tonight. We certainly appreciate it.
Thank you for having me.